Hello everybody. This is Alyssa from Mink Arts and Crafts. Move this over. And today we are here for a WIP and chat. So WIP stands for work in progress. Sorry, Sushi's distracting me. She's over there distracting me and being silly. Trying to do things. I'm trying to do things that she shouldn't because she's being silly cat. Silly cat. I just grabbed a sushi head. There's a sushi head right there. She just squeaked at me. So WIP stands for work in progress. Chat, we're going to sit here and chat, talk a little bit about the week, all that fun stuff. What we've been up to, all of that. Rigmarole. Huh, Susu? She's like, Mom, you moved the easel over. I did move the easel over. It was blocking. I had to block. What are you doing, Sushi? Why are you being difficult? Come on. What are you doing? Get out of there. Sushi, come on. In or out? Move. Get out of there. What are you up to? Suzu, she's just being so distracting right now. You're making a mess of stuff. Come on, stop. All right. Anyways, we're going to be working on a WIP and chat. The canvas I am doing is I See the Light from Diamond Art Club. It is the Disney Rapunzel canvas. And as you can see, I'm a third of the way through. I've got 4 sections on the bottom done, and I have 2 sections on the bottom left to go. This canvas is pretty large overall. I'm trying to remember what the dimensions are. I think it was like a high Susu. You can't have that. I have a sushi. There's a sushi. She's like, hi, here I am. That's bright. But I'm holding a sushi apparently. It's like 55 something by like 100 and something. I can't remember the exact dimensions, and it's rolled up over there in the corner, so I can't read exactly what the dimensions are on this one. But you can see this is what I have done on it already, and then the rest of it over to there. It's really interesting because the glow of the lanterns give like a really like reddish, orangish tone to the skin tones of the characters of Rapunzel and whatever, I can never remember his name. But it works. It totally works. So that's something that I'm working on. A lot of the darks with this, a lot of like 310 and a lot of like blues, like a 939 and 823. Those are like the 3 primary colors for this. A lot of those colors. I'm going to be working on basically 310 for you guys. That's what this entire area of symbolage, this whole section here is 310, and then this is 939, that little section right there, and then a little bit of the lanterns. So that's the kit that I'm working on. The pens that I'm using right now is this gloriously gorgeous pen. I think they're the same ones I was using last week from Enabler's Outpost. I haven't swapped my pens. And then this beautiful one that I got from a D-stash, which I don't know where it came from, but these 2 beautiful pens. And then I've got a couple cover minders going on. So these are the 2 cover minders from Shenanigans. These are the ones Nicole made for the event. This one right here, you better, if you want to buy it, you better hurry up and buy it before the end of the month, because it's only going to be available through the end of the month. But she is going to have the Year of the Snake available all year long. But this is the Lunar New Year DP along cover minder. And we will be drawing, actually that's going to be one of the things that we will be talking about, is the giveaway that we'll be doing for this week will be that you'll have to comment in the video for this week. One of the things is going to be a set of these cover minders. So we've got those. So with the cover minders there, I am actually using one of my other sponsors is Ephemera 3D. So I've been using one of the trays from it, and I decided since I was using the Sneck cover minder, I would use the Sneck tray. But then the other tray, if I can grab it over here, is Year of the Snake right here. So here is the set of trays, and I will be giving away a set of these trays today to a winner, and then I will also be next week the winner will get we'll have 2 winners. One winner will get a set of trays, and the other winner will get a set of cover minders. But this is another one of my sponsors, but I'm using this tray right here right now, and I love it. It is a fabulous tray. It's perfect for all of this large area of color blocking. I am using WIP. My WIP for the event has arrived, but it is in my parents' house, so I do not have it with me right now. And then it is Orange Crush WIP, and I'm super excited for it. And then so that is what somebody will win today, is a thing of Orange Crush WIP. as well as somebody else will win a set of trays. And then, so I'm using wax in my single placer. Boop. And then I am using some Rando's putty because I'm trying to use up this thing of putty. I'm using coconut eggnog scented putty. I should probably actually reload my putty because I'm about to get started with a lot of color blocking. So I'm going to reload my putty, and I like to start from scratch. So I am going to pull the putty out and reload the putty on both of these pens. So I'm starting fresh because this is some used putty. It's at least like I've just been reloading the tip of the putty. So I'm going to reload the putty on both pens before we get started. And I hope everybody has been having a wonderful week. Everything has been going great for you guys. I have been, oh my goodness, I feel like it has been a whirlwind. I'm in like the final countdown of everything before I get to close on my house. I'm excited for that. It's so awesome. The final countdown. It's so close. I can't wait. My next WIP and chat, I should be filming from the new house. I won't have any of my actual stuff. I'll still be using like my I'll still be using like the pseudo setup, but I'll be able to set up in my own house. So I'll do like the folding table and then the chair that I'm sitting at now, but I'll set up in my own house next week, which is super exciting. And yay, that's gonna be awesome. But so this time next week I will be in my house, which will be nice. It'll be weird because I've been in I've been in the RV for so long. Since I've been in the RVs for so long, it's gonna feel really weird to be in the actual house again and not be out in the RV. All right, so now I can go ahead and put the putty back. And this is how much putty I have used. I've been working my way from like 2 sides. So we're gonna put that back, put this back, and we are gonna get started. Let me turn the overhead off. Well, that overhead. I still have the overhead, which is gonna give us this ugly little glare right here just because of where it's positioned and everything. And let me pour some drills. Actually, I need some drills in my things. I'm using 310. Boom, boom, boom. Pour some drills in my tray. And we're gonna get started. Woo. These drills line up beautifully. I like to pour a lot so I don't have to keep refilling. But look at that. Look how beautiful they lined up. And this is some 310s. And now I have to decide because this is like right in front of my head. So I'm like, where am I going to work from? I did want to fill in that one. Because I like to be able to see what I'm doing, and I can't quite get as close as I would like with this setup. I can't wait to get like my normal setup and be able to do things normally. That's gonna be nice. Those were not placed very well. Ugh. Okay, so and get away from like this immediate placement up underneath my camera. Let me go under my camera into the side of my camera. So that way I can see what I'm doing a little bit better. This is why usually you'll see me like placing, normally I always work from left to right, but on WIP and chats I always kind of I would like start over here and then go that way because of the placement of the camera. It just gets in my way. And so anyways, this week, oh my goodness, what have I even done this week? Oh yeah, it was the holiday. So I started off, this last weekend. My WIP and chat was late because I was at my parents' house for the weekend, visiting with them for my dad's birthday, and Monday was the holiday. And then I drove back on Monday, so it was like basically Saturday we were at the Fiddler Crab Festival, which I talked about last week. It's my WIP and chat went up on Sunday, and then Sunday we just kind of chilled and hung out at their place and just kind of relaxed a little bit. Did some stuff, and then Monday my dad did some work, and then my mom and I just kind of chilled. I finished the Storm God on Monday morning before I left. I got up and Started working on the Storm God, like got up in the morning, worked on the Storm God Monday morning because I was like, I want to finish this. And I finished the Storm God on a Monday. Oh my goodness. Can you guys believe it? Finished the Storm God, which is why you do not see the Storm God being worked on right now for like the first time. I am not working on the Storm God for a WIP and chat. Crazy, right? So I'm working on something different. So I'm working on this kit for Kate, Pixie Sticks. She's doing the Disney DP along this month. So I decided to work on this one because it works for my event with the lanterns, and it works for her event because it's a Disney kit. So I'm kind of informally just kind of tootling around on it and working on it. We're going to see how much of it I get done if I actually finish it this month. I don't know if I will finish it this month or not. I'm going to try to. But it's going to be, this next week is going to be pretty busy. So I'm going to see how much I can do this weekend. But if I don't finish it, I'm not going to stress about it. Because, like I said, I'm going to have a really busy week coming up. But yeah, it's going to be, so Monday, finished the Storm God, packed up my stuff, and then threw the girls in the car, and then headed back across to my side of the state. And got back and had to empty the tanks on the RV. Basically with the RV, it's kind of like, it's a contained system, so you basically have to do your sewer, essentially your sewer stuff. You have to empty the gray water tank and the black water tank. The black water tank is essentially your sewage, and the gray water is like your shower water and your sink water, basically. So I had to empty those tanks when I got back because I didn't feel like doing it before I left. So I emptied those on Monday and then just kind of chilled, relaxed. Did I do any diamond painting Monday evening? I can't remember if I did any diamond painting Monday evening on this kit. Or maybe I did. I think I grabbed one of like the small, like the Sailor Game Boy kits, I think. I can't remember what I did on Monday night, or if I just kind of chilled and hung out on Monday night because I was tired after the drive. But I don't know. Whatever I did. And then went to work on Tuesday, and thankfully it was a short week of work because I was like, ugh, I was not having it with the focusing this week. So Tuesday was a short week of work. Or Tuesday was a short week, yeah. There was an entire week in Tuesday. But I had to work on Tuesday, and then on, which was a normal day at work. And then Wednesday, I did my normal patient day. And then at the end of the day, after seeing patients on Wednesday, I had my PCM appointment. And did I get, no, actually on Tuesday, I think on my way home on Tuesday, was it Tuesday? That I got groceries. Or was that Thursday? I can't remember anymore. No, I think it was, what day did I get groceries? No, I think it was Tuesday that I got groceries. Yes. I was like, I did something Tuesday. On my way home from work on Tuesday, I got groceries because I needed groceries because I was basically out of lunches. So I got groceries on Tuesday so I could have lunches. And then Wednesday, normal work day, normal seeing patients and everything. And then at the end of the day, my afternoon is admin stuff, so I was doing admin stuff in the afternoon. And then I had a my appointment with my PCM to kind of do like the established care that I finally got around to setting up. And basically, like, the gist of it was, because I had raised, like, my concerns were, you know, like, the sleep, the insomnia, the not being able to sleep piece, I needed to, the ultimate first priority was I needed to get referral for getting my Botox injections for the migraines. I need to get that rolling, because I haven't had a Botox injection since, oh gosh. It's been a few months. It's been since, like, I think the fall since I had my last one. I think like August or September. I would have been due for one while I was while I was traveling for PCS. So I'm overdue for my quarterly Botox injections, basically. But so that was one of the things I wanted to do. And then one of the things I actually wanted to talk to him about was the potential of trying like a different preventative medication, because I'm on like a daily preventative for the migraines. But obviously I still have close to 20 migraine days a month, which is basically means that my preventative isn't really doing the greatest job as a preventative. So I wanted to talk to him about my PCM, about like seeing if there was something that we could switch me to that would be a little bit more effective, because obviously that one was not very effective. So that was part of what I wanted to discuss, was seeing if there were other options. I also wanted to discuss like the whole insomnia, not being able to sleep, which has been pretty consistent for like this past year, having difficulty sleeping. And also my difficulty with like concentration and focus and like initiating tasks, but the concentration and focus for work piece of everything has been a big part of it. And then also like with the insomnia and everything and the lack of sleep, I've noticed over the past year that I've put on like a significant amount of weight over this past year, which if you're not sleeping properly, your body's not getting the rest it needs. That's actually something that can happen, is you can put on a lot, you can like gain, a significant amount of weight. And I definitely have. So that was something that I had voiced concern wise. So basically he focused primarily on the migraines, because I mean, you're there for a short appointment. We have a follow-up appointment scheduled. So he focused on the migraines because he thinks that that's going to be what's affecting a lot of everything else. So he agreed, yep, we definitely need to switch medications. He thinks that the medication that I've been on could be contributing to the concentration, lack of focus side of everything, because I do have other side effects from that medication. Like I have to take heartburn medication because one of the side effects that I get is pretty gnarly heartburn from the migraine medication. So I do get side effects from the medication, which some people can take, migraine meds and have no side effects. I'm one of those people that apparently I do get side effects from the medication that I'm on. So I've started titrating the medication down, and to then start, because you don't just stop cold turkey when you've been on a medication that you had to build up dosage wise. You have to wean back off of it. So basically I'm gonna wean back off of it, decrease the dosage until over the next few weeks I'll decrease the dosage, and then I will build up, and then I will start taking a different medication instead, to try that one instead. And then he also ordered basic blood work as well, because so that way he could do like my annual well exam, like annual physical well exam type thing. So he ordered like the blood work for that, which I got done today actually, because I didn't have time to do it yesterday, Thursday, because it was such a busy, Thursdays are like my longest day in the clinic. So I was like, I don't have time to run to the lab and get labs drawn. So I had to wait until today, because Friday is a slower day for me. So, so I went today, Friday, to get my labs drawn after I finished my morning patients. So it was like 11 o'clock or so when I went down to the lab to get my blood work drawn. And so did that. And I should have those results back next week. I'll check my patient portal next week and see what the blood work had to say, if there was anything that was abnormal or anything like that. See what it had to say. But did that, switching the medication up, focusing on seeing if that helps, because he's like, that can help with the part of it, could help with some of the sleep, switching the medication, also with the concentration. Also, I've got to work on my sleep hygiene, and we're going to see if all of that helps with that part of everything. And then depending on how everything's going at the follow-up in 6 weeks, we will do next steps from there. And that's going to be a big part of it, is doing next steps, kind of deciding after that. But first thing was kind of switching medication up for the migraine and then proceeding from there. And then have the referral in. I'm just waiting to hear from them for the Botox injections, to get those done and then kind of progress from there. So that'll be good. I'm making progress. See, this is all the same color. It'll be all of, except for that right there is this 310. So I just get to cruise with the color blocking while I talk to you guys, which is, you know, nice. I don't have to, that's why I decided I could have picked and worked on all the other colors that don't really have, like all the other colors that are in here. I could have done all these other ones. But I decided, you know, I'm just going to do the 310. Just do the mindless color blocking, which I enjoy doing. I love color blocking. To me, it's relaxing, just sitting here and just aimlessly plugging away at one color. I enjoy that. Some people despise color blocking. Natalie, she despises her color blocking. I love my color blocking. Also, if you are not following Natalie, then go give her a follow. She is Diet Coke and Diamonds. Go give her a follow and listen to her shenanigans and chaos of everything. And she has the cutest dogs ever. They are adorableness embodied with her new little baby puppy. She's got Bisky and then Moose, the cutest little guy ever. He's a little baby. But anyways, I digress. So back to... I distracted myself, yeah. So had the appointment on Wednesday, and then I'll follow up, like I said, I'll follow up with my PCM in another like 6 weeks or so to see how everything's going with the switch in medications. And then Thursday, busy day in the clinic. It was a long day of patients yesterday. I had a pretty full day on my schedule. And like my second to last patient of the day yesterday was a follow-up. This patient was like an Achilles repair, and he was like 12 weeks post repair, so he's pretty decently far out. And one of the things that you always want to be, you know, as a provider, I always am on the lookout for when I'm seeing a post-op patient, somebody who's had surgery, especially when you're working with somebody who's had an Achilles repair because they've been or any kind of ankle surgery because they've been immobilized for so long. You always want to be on the lookout for any kind of like DVT or deep vein thrombosis or blood clot, basically. But usually you're more aware of that in the first 6 weeks is when you're most concerned for it. It's something that you're not really so super concerned about when somebody's coming in and they're like 13 weeks post-op. And basically have started, like, he was a little bit delayed on when he was allowed to come out of his boot because he had fallen and kind of tweaked it a couple weeks after surgery, so a surgeon wanted him in the boot a little bit longer. So he'd been in the boot a little bit longer than normal, but we've had him out of the boot, and we've been basically this past couple weeks we've been weaning him out of the boot into normal walking. So you know, that's what we've been working on. He's been working with us in physical therapy for like the last 6 weeks. So he came in on Tuesday for his appointment, and he was having a lot of pain behind his knee. And it was just like no swelling, no redness, just some soreness behind his knee. But he was like, he did do a lot of standing over the weekend and a lot of standing at work for some stuff that he had to do. So I did, and it was like, okay, this looks like it could be like a little irritation of his popliteus, which is, you know, something that can happen when, you know, you've had somebody that's got an altered gait because they've been walking around in a boot all the time. So I was like, okay, well, I'll keep an eye on it. And I knew I was seeing him on Thursday, but that was like really his only symptom was that it was pain in the back of the knee and no redness, no swelling, nothing like that. He was seeing my one of my physical therapy assistants. So he just called me over to take a look at it. And so I just took a quick look at him, and I was just like, it doesn't really, nothing super concerning at the time. From what he was saying on Tuesday, it started bothering him on like Saturday. And it was worse, and it was uncomfortable for walking and everything. So I'm like, okay, well, take it easy over the next couple days, and if it gets worse or anything like that, let me know or whatnot. Well, he came in to see me on Thursday for an actual full-blown reevaluation. I'm talking to him, and I'm looking at it, and I'm like, okay, now he's got some redness in his thigh, like in the knee, and in that like discoloration and redness in his knee. And I'm like, okay, he definitely did not have redness on Tuesday. And I'm like, and you've got like the tenderness is much more than just behind the knee. Now you're tender up into like the distal thigh, or like the bottom of the thigh, the lower part of the thigh. He's tender up into like the top of the calf. He's got some swelling and tightness in the calf as well. And I was like, dude, I think you've got a blood clot. So of course I didn't just tell him, dude, I think you have a blood clot. I basically phrased it better than that. But essentially it was like, dude, I think you got a blood clot. I'm going to send you to the emergency room so they can rule it out. And best case scenario, it's just that irritated muscles back there. You overdid it. As you're coming out of the boot, walking around, you overdid it and you ticked everything off. You made everything angry, and you're going to walk around, pull your crutches back out, walk around the crutches for a couple days to take it easy. And then you'll be, good to go. It'll calm it down and you'll be good to go. That's the best case scenario. And then you'll have just wasted a few hours in the emergency room. Worst case scenario, which is kind of what I'm expecting to happen, is you're going to go in there. They're going to do they're going to do an ultrasound, and they're going to find that you have a blood clot, and they're going to do a D-dimer in their test on you and also find, that everything's elevated. For the D-dimer, they're going to say, yep, there it is. And be like, yep, you've got a blood clot. So this is what I expect to happen. Regardless, we're going to take you over to the emergency room right now, but I'm going to call over to the ER and let them know that we're bringing you down. So that way, kind of that provider to provider handoff, to let them know. And he was like, yeah, I'd rather be safe than sorry. And I'm like, exactly. That's why I'm sending you to the ER. I'd rather us be safe and it's not a blood clot than to have it be a blood clot that we did not send you to the emergency room for, and it becomes and then you end up having it dislodge and cause a bad day. So we popped him in a wheelchair, took him down to the emergency room, took him down to the ER, got him in, got him seen, and that was at I think we dropped him off at almost 3 o'clock in the afternoon. So of course, by the time I left for the day at 4, they were just getting started with him, but they didn't have any of the notes in the system. So I couldn't check status to see how he was doing. So today, Friday, that's when I could finally actually that's when I was like, okay, notes will have been in. I can see what the status was for him and kind of check on him and everything. And I pulled everything up and looked, and I was like, and actually I was like, okay, I'll check on the notes when I get a free moment. But before I do that, I have to pull up, because Fridays, after I see my morning patients, I just bumped this with my head, sorry. Fridays, I actually have the late morning from 10:30 to 11 or 10:30 to 12 blocked for me to go. In case I get an inpatient consult, that's blocked for me to go upstairs to see inpatients. So I pull up on the system, change the view or whatever for me to look and see if I've gotten any inpatient consults. And I look, and guess what? Sure enough, I have an inpatient consult. And I'm like, no way. And sure enough, the inpatient consult that they gave me was for my patient that I had sent to the ER for the blood clot, yes, he did have a blood clot. Which I was not surprised about. I figured he did. But he was admitted overnight because of how big the blood clot was. They admitted him for observation, and he had basically, the blood clot was so big, it ran from his basically lower calf all the way up to his mid thigh. In the back of the leg. That's how big this blood clot was. So he had a very large blood clot. Very large one. So I was like, dang. And he literally only had symptoms for a couple days. So, but they admitted him. So I was like, okay, I'll go up and check on him. He doesn't need me to evaluate him. I don't know why they're putting in a consult for physical therapy, but he does not need me to go in and evaluate him, because he's perfectly independent and can walk around by himself. He does not need physical therapy to go in and to get him up out of bed and try to take him for a walk, because he's perfectly capable of walking. He doesn't have crutches at the hospital, so while he's still admitted, then I recommend they snag a pair of crutches that they can give him that he can walk around by himself to kind of offload and decrease some of the pain from walking. But he doesn't need physical therapy to walk with him. He's literally completely independent. I mean, I've been working with him in outpatient for the last 6 weeks, and he's independent. So I was like, yeah, I'm not going to evaluate this kid, but I will go upstairs and check on him because he's my patient, and I'm the one that sent him to the emergency room in the first place, that got him admitted. So obviously I want to go talk to him and see how he's doing. So I'll go up there and do that and tell the nurses that I'm not going to actually evaluate him, even though there's a order for me to evaluate the patient. I'll put a note in the chart saying that I'm not evaluating him and that he's independent and does not need to be evaluated by physical therapy. But I'm not going to evaluate him because that would be a complete waste of time. Because I know I had literally the day before done essentially a much more thorough evaluation than what I would do in the inpatient realm, a much more in-depth evaluation in outpatient the day before, when I did his follow-up and decided and determined that I believed he had a blood clot and needed to go to the emergency room so they could truly do the full assessment and confirm, yes, he has a blood clot, and treat him for said blood clot, which, yeah, that's exactly what happened. So it was funny because when I called over to the ER and I was telling the front desk passed me over to the one of the ER doc, and the ER doc was like, well, I told him what I thought it was, and he's like, well, it could also be cellulitis. And I'm thinking in my head, or it could be a DVT, because I'm like, this is not my first rodeo. I know what a DVT is like in a post-op Achilles repair, and he screams DVT, so I think he's a DVT. This is not a cellulitis case. This is a DVT case. I've had patients come in and be like, that's cellulitis, and he is not one of those. I've had the spectrum of issues working with, my population. I was like, this is not a cellulitis case. But I kind of was like snickering to myself. I didn't say anything because the doc that I was talking to was, he was, he's like a captain, but he was like, yeah, well, it could be cellulitis too, but we'll have to work him up for everything. And I'm like thinking to myself, or it could be a DVT. Because I was like, yeah, I think he's got a DVT, so I'm sending him over to you guys to, get fully assessed for it and everything. For that, fully assessed and then potentially treated if that's what he actually has. But I gave him like, this is what he's got, these are his symptoms, blah, 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 blah. This is what his pain is, this is the redness, the swelling, the tightness, the pain, blah, 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 blah. And it was so funny because the doc was like, oh, well, I was like, so I'm suspicious that he's got, DVT going on. And the ER physician was like, or it could be cellulitis. And I'm like, yeah, it could be cellulitis, but no, I don't think it is. And no, it was not cellulitis. It was a very, very large DVT. The largest one that I've had on a patient. And for it to present that late after surgery, when he's an active patient, he's been up and moving and doing all of the things. But come to find out, like, he actually, when he called his mom, because he's like 29, so he's not like he's super young or anything, but also not like he's super old. So when he called his mom, when he was being admitted and everything, to tell her what was going on, she was like, oh, by the way, your dad, after he had some outpatient surgery, apparently had the same thing happen. He developed a DVT after a surgery, and for us, but she didn't, like, when he had this ACL, or not the ACL, when he had the Achilles repair, she never told him that his dad had a blood clot after, so he didn't know that he has a family history, because that's actually something that if you have a family member who has had a surgery and has developed a blood clot after having had an outpatient, or not an outpatient, but after having had like a surgery like that, that's actually something that you need to tell your surgical team at your pre-op appointment before you have surgery, because that means that there could be a genetic factor and you could be genetically predisposed to actually develop blood clots. Because I've actually had that's the second patient that I've had that this has happened, and they've actually, when they look into it, they find out that they actually are genetically predisposed for clotting. when they actually do the testing and find it out. They find out, oh, you actually have this specific clotting factor, and it's a genetic thing. And I've also had patients before that when they go in and have surgery, because they have their family members have a history of clotting after surgery. So they give them extra preventative medications to prevent clotting if you go in and have a surgery like this. So that's something to keep in mind if you have a family member who has developed blood clots after a surgery. Tell your doctor that when you're doing any of your preoperative appointments, because that's important information. But this was a case of his mom not telling him that his dad had blood clot after surgery. So he didn't know, which means he couldn't tell his healthcare team, which means none of us knew. So he was basically a ticking time bomb, essentially, is what it was. But nobody knew until I did his follow-up and was like, this isn't right. I think he got a blood clot. But thankfully we caught it in time, got him in, got it treated in time. And he was admitted overnight, got the medications he needed, and they ended up discharging him today as well. So he was just in overnight for observation, and I think it was mainly because it was such a big clot. If it had been like a normal average sized blood clot, they would not have admitted him. It was just because it was such a large clot that they ended up admitting him overnight. But yeah, it was crazy. But it was so funny. When I went up there and was because I was like, I'm gonna go up there and visit him, but I'm gonna stop at the nursing station and let his nurse know that I'm not gonna be doing any evaluation. I'm just up there to visit him as his therapist, as his as his physical therapist, i.e. I'm just going up there to visit him. I'm not going to do an evaluation because he does not need an inpatient physical therapy evaluation. Completely unnecessary, not needed. So I'm going to let them know. And then the nurse was like so puzzled. So she's like, but ortho wants him up and moving. And I'm like, okay, great, get him up and moving. And she looked at me like completely flabbergasted, like, but you're not going to evaluate him? And I'm like, no, he does not. She was like, you're not going to evaluate him? And I'm like, no, he does not need to be evaluated. She's like, but how do you know? And I'm like, because I've been working with him for the last 6 weeks in outpatient physical therapy. He does not need an inpatient evaluation. He does not need me to evaluate him. He is completely fine to walk. Give him a pair of crutches. He can walk without crutches, but because of the pain from the DVT, he'd walk better and move better and cruise around the ward if you gave him a pair of crutches. He can walk fine without the crutches. It's just going to be really slow, and it's going to hurt for him to put weight on that leg because of the DVT, but he can walk. He can walk just fine. He has no limitations. Literally, like, he's in the hospital because he has a DVT and for observation. That's why he was admitted. There's nothing wrong with him as far as, his ability to ambulate and move. She's like, well, should he be doing exercises? And I'm like, yeah, he can do his exercises. He knows what exercises he can do. He can do his bed mobility exercises. He can do I'm not going to have him doing any of his high level exercises that he's been doing in physical therapy when he's got, an active clot that's just started treatment. I'm not going to have him doing all of the stuff that we've been doing in outpatient downstairs when he's, freshly diagnosed with a blood clot and they're working on, clearing up the blood clot. I'm not going to have him doing anything super high level right now, but he can do, basic bed exercises, like some of the stuff that he did early on in his rehab, which he knows all of those exercises, and I'll go tell him what to do exercise wise, but I don't need to evaluate him to tell him this, I don't need to evaluate him to see how he's moving, to say, yes, he's independent, he can roll around in bed, he can sit up in bed, he can stand up by himself. I don't need to evaluate him to tell you that he can do all of this. I literally know that he can do all of this because I watched him do it less than 24 hours ago. He was completely independent in all of this a little bit ago. He's completely fine to do it all today. His status did not change. Like, his functional status did not change. The only thing that changed is he's now taking medications for said blood clot that he was not taking yesterday. That's literally the only thing that had changed from yesterday to today. But the nurse was just like flabbergasted that I was not going to evaluate the patient that had been, the orders that had been, the order had been put in for me to perform an evaluation on this patient. And I was not going to evaluate the patient. And I'm like, no, because it was an unnecessary evaluation. I'm not going to do something that is completely unnecessary. And that's completely within my prerogative as a provider. I can say, nope, that's an unnecessary order. I don't need to do that. Nurses can't do that because they're not licensed individual practitioners as a nurse like that. Now, a nurse practitioner, that's a different story because they are, they have a lot more independence. But a nurse up in the ward can't just say, no, I'm not going to do that, because they have to follow the orders that the doctor puts in. Me, a little bit different because I have my own license that I'm practicing under. So a doc puts in orders, like the surgeon puts in orders for a patient, for whatever it may be. Like, even if like somebody puts in orders for physical therapy, puts in a referral for physical therapy, they can say, like, they want me to do, like, they can say, oh, I want you to do ultrasound and I want you to do XYZ with this patient. I'll look at that order and be like, there's no way I'm doing ultrasound on that, because ultrasound has like some of the most horrendously poor research backing it up ever. And I'm like, I am not doing ultrasound on that patient. There is absolutely no way. So I refuse. So I will not be doing ultrasound on that patient. But yeah, so basically I can completely ignore like those parts of the orders and say, nope, not doing that, because I'm using my professional judgment and my training as what I have as a physical therapist. And I can say, yep, nope, because that's completely within my rights and within the boundaries of my license to be able to do that. So me saying, no, I'm not going to evaluate this patient, he does not need this evaluation, is completely appropriate. But the nurse can't say, when a doctor puts in orders for something, a nurse can't just say, we're not going to do this. That they can't do. So she was completely flabbergasted when I said, I'm not evaluating this patient, because it's like, it was such a foreign concept for her to grasp. And I'm like, no, he can walk. She's like, but it was like the look on her face, the fact that I told her that I was not evaluating this patient and I would not do it. She was like, but he needs to get up and, like, the doctor wants it up and moving. And I was like, great, get him up and move him. Like, which really, realistically, that would just be more like making sure that, because he was hooked to multiple like IV lines and telemetry and all that stuff, it would just be more managing the lines for him while he walked by himself. He could do all the walking himself. He would just need somebody to hold the lines for him. So he doesn't have to. But realistically, the patient could walk just fine by himself. But I was just like, oh my goodness. They'll learn quickly that I'm not somebody that will do something just because you put in an order for it. I'm like, no, I'm not going to do an unnecessary evaluation. It needs to be an appropriate evaluation. If it's an appropriate evaluation, then yeah, absolutely. It's like when I was in 29 Palms, I think I mentioned this story way back when I was still at the hospital. Probably, it's been a hot minute since I did this one. But one of the orthopedic surgeons had put in an order for, or requested physical therapy to come see a patient, but she waited until like 3:45 on a Friday afternoon to call me to say, hey, can you come see this patient and do an evaluation on this patient for discharge or to see what for like discharge recommendations, or not even discharge recommendations, just to basically to train him on how to use the appropriate assistive device. So this was a guy who had fractured his pelvis in multiple locations and had surgery on it. And then he was on a platform. Basically, he had a broken, he had a hand surgery, so he couldn't put weight through his hand. So he had to have a platform walker. So he was non-weight bearing on one leg, but also non-weight bearing on his hand. So he had to have a platform walker and be where your forearm is, where you're bearing weight through, and not your hand. And it was just like, so he had just gone in and had surgery on his hand that day, but they wanted to, and he was going to be transferred to, over the weekend, he's going to be transferred down to San Diego for surgery on his pelvis, for some extra hardware implantation for that. And she wanted me to evaluate him to make sure he was good with the platform walker. And I was like, has he already been using the platform walker? Yes. Well, why do I need to see him? And I was already at home. It was 3:45 on a Friday afternoon. This was a planned surgery. They knew at 8:45 that morning that they were doing surgery on this kid. He was literally the first surgery of the day. So she waited until after he had come out of anesthesia and recovered, and was in, recovered from the PACU, to call me. So she didn't notify me at 8 o'clock in the morning when I was at the hospital, hey, I've got a patient that's coming out of surgery in a few hours that I want you to come see a little bit later today, which would have been the course of action, because this was a planned surgery. Or she didn't call me the day before saying, I'm going to be doing surgery on this kid's hand. Can you come see him to make sure he's good to go and recommend assistive devices for him? Because I would have told her then, I would have said, oh yeah, absolutely. And I would have planned it into my schedule and seen him Friday afternoon before going home. No, she waited until 3:45 on a Friday afternoon when I was already at home, because there was nothing else on the agenda, and it was one of the few Fridays that I left before 4 o'clock, because I normally would be there until 4 o'clock. So it was one of the very few Fridays that I had actually left at 4 o'clock. Called me, and I'm literally had just walked in my front door, and I'm I'm not going to turn around and come back just to evaluate this patient to say, yes, he's needs this front wheel walker, or this platform walker that he already has and has already been using for the last 2 weeks. So he doesn't need me to teach him how to use it. And to recommend that he also get a wheelchair, because he's going to need that in addition, which I told her, get him a wheelchair too, because he's going to, especially if you're going to be expecting him to go in for another surgery, he's going to need the wheelchair, especially if you want him to be non-weight bearing on his hip now, which he wasn't before. He's going to need the wheelchair too, for those longer distances with that platform. And I was order him a wheelchair as well. That's going to be the proper course of action. It was just but the fact that she didn't even think about it until almost 4 o'clock on a Friday afternoon to call me and be like, can you come evaluate this patient? I'm like, no, I can't. I'm at home. If he's still here on Monday, we can come do it, because we don't have inpatient coverage on the weekends. But what do you want me to do? What do you want me to see him for? Well, to teach him how to use his platform walker. Has he been using the platform walker already? Yes. Why do I need to teach him how to use it? No answer. But you could tell that she really wanted me to come back and evaluate this kid. And I'm like, what's the plan? Well, he's being transferred to Balboa, to San Diego, where he's going to have another surgery on Monday. I'm like, okay, so he's being transferred this weekend. So you don't need me to do discharge recommendations. So I don't need to come in and evaluate him for discharge recommendations. So, and he already knows how to use the assistive device that you have. So why do I need to come see this kid? And she had no answer for me. But you could tell it, but she literally wanted me to come in and see him. And I was like, yeah, I'm not coming in and seeing this guy. I'm not going to go in and see him to verify that he, when he's been using his walker for the last 2 weeks already. I'm not going to come in and see him just to make sure that he's good to go when he's already been using this same exact walker for the last 2 weeks. Anyways, that was my little rant on that. Making good progress on this. I mean, look at how much of that I got done. This is all the 310, so making really good progress. I'll get this section done, and then I'll come up and do this section, and then I'll get the little fiddly stuff in there. But making good progress on it. Oh, I did buy the 2. I did say that I told you guys that I bought the 2 kits last weekend. The Mrs. Butter. Did I tell you guys that I bought them? Oh yeah, because I was talking about how I had like the really bad internet coverage and almost missed them. But I did buy the Yume and the Mrs. Butter last weekend. But this weekend I will not be purchasing anything because nothing talked to me. I know a lot of people are super happy that I should probably have put before I start talking about all that stuff, I should probably put my break of drawing the prize winners. So we will do that.
All right, so we are going to come in here and we are going to paste I have to delete the old link. We are going to paste our YouTube link. Boop. There is our YouTube link. We're going to come down and solve this. See how many YouTube comments we have. 23 comments. And we are going to pick our first winner. And this is going to be for the trays. Woohoo! So there we go. So our first winner for the trays. Congratulations. And now we're going to do our second winner. And this is going to be for the WIP. All right, now for our second winner, which is going to be for the WIP. So let's pick that second winner. Woohoo! There we go.
Woo! So those were our two winners. Congratulations to our winners for winning the set of trays and the WIP. One of you for each of you guys, or well, one of you won one and one of you won the other. And now our new word for moving forward, which one winner is going to win the final set of ephemera 3D trays, and the other winner is going to win a set of cover minders. So that one we are going to do, what word do I want to use? We're going to use boat, because we've already used lantern, but we have a boat right here. So we're going to use the word boat. Let's use the word boat in a sentence, because, that works for me. I want to hear boat in a sentence. And that is going to be for the two things that we're going to draw for this coming week. And go from there. I will have multiple things being drawn in the final week. In addition to the grand prize, we will have multiple things being drawn. But yes, anyways, I am not purchasing anything this weekend. Yay, finally a break. I know a lot of people are ecstatic because they finally are releasing another one of the Roy Trin Sailor Scouts, or Roy Chin Scouts for the Sailor Moon series, his version of the Sailor Moon series. So I know some people are super stoked about that, because it's been a really long time, I feel like, since they released the last one of that series. So that's been very much long overdue. So super excited for that, for everybody that wanted to have that series released. So that's exciting for everybody. And now I'm just waiting to see. I'm trying to think if there's anything specific that I'm waiting for. There is not. I know everybody's now waiting for the rest of that series to be released. Hopefully, since they released the one, they start releasing the rest of them for everybody. But hopefully it's not like all back-to-back weeks, because I know that gets rough on people's budgets, especially like all of my Yume fans. Like, we've been struggling. We've been on the struggle bus with how closely everything has been going. I spent so much time ranting about all of the work stuff and my little soapbox that I had for all of that I completely forgot to talk about the fact that I am down to just like the last few days, and then I get to close on my house. I am so excited about that. So I'll be closing on my house soon, and then once I close on the house, I get immediate possession. I know in Hawaii, when I did my closing paperwork, I had to wait a few days before I got the keys. So I think I closed on like a Tuesday, and then I didn't get the keys until that Friday. But this here, I will do the close, and I will get sign the paperwork, and then I will get to pick up the keys the same day, which I'm like, yes, that's gonna be exciting. And I go next week, on the day before I close, I'll go do the final walkthrough with my realtor. We'll do the final walkthrough, and then closing will be the next day. And then, so I have that day out. The closing day, I have that day off from work. And then I have the closing day off from work, and then I also have, and then I'll go back to work the next day, and then I'll have the following day off from work as well, to do some additional, stuff, because I gotta paint the house. So that's really gonna be what I'm spending a lot of, like, late next week into the weekend doing, is painting the house before my household goods to get delivered the following week. So I'll have all of my stuff in just a couple more weeks. I'll have all my stuff. So my next WIP and chat will be, I'll probably do it from inside the house. I'll probably just set up the table and chair potentially inside the house, or rather, because I'll have already broken everything down from in here in the RV in order to move the RV over. So I might as well just have it set up in the house. So that way I can, DP in the evening when we're done painting and everything, and do that for a few days until my household goods get delivered. So yes, my next WIP and chat will be from my house. I'm so excited for that. Anyways, I'm gonna turn off the this so you guys can see what progress we made, and look at that. You can see the glimmer of this. So this is 310 that we've been working right here. All 310. It is coming along nicely. This whole section has been 310, whooshing right through. And once the light is off, you can actually see the color of all the other stuff on here. It looks really good. But we've got a big section of 310 done in the last, 50-ish minutes or so. So that's looking pretty good. And then I've got a section of brown up here. That section of brown. Let me see if the light will turn back on. Here, let me do this. There we go. So now you can see this is our 310 that we just did. Got some random pieces of gapping because I'm not a very good placer. And then you can see how beautiful, like, the color is over in there, and how much I have done of this section. I just have to finish out this little piece and then this piece of 310 here. So this is 310, and then here's 310, and then we'll be done with that section. But it's looking good. And then I will have that section done, and then one more section to go, and I will be halfway done with this painting. Woohoo! This is a long one. It's very long. Whew, where are the yawning? I'm tired. It's been a long day. It's been a long week. I feel like I've been doing lots of random paperwork. Be like, oh, I've got something else to sign in my email inbox. Let me go sign that. Oh, got something else now. But anyways, that is all I have for you guys for today. I'm going to let you guys go so I can edit this and go to bed because I am tired. But I'm trying to go to bed at a better time and not stay up until the wee hours of the morning. That is my goal, to not stay up until forever in a day. But that's all I have for you guys for today. So I'm going to let you guys go. Have a wonderful day, everybody. And I will see you guys in the next video. Bye.